The low squat is a rest position. In this position, your ankles express mobility, your knees reach full range of motion, your T-spine corrects for postural support, and your weight encourages enough stretch to help smooth out the fascia in your pelvis, helping to relieve the SI joint. This position is worth training your body to achieve. Start in a standing position with your feet hip-width apart and toes straight forward. Fold forward, reaching for the floor in front of you as you reach your hips back, feeling a stretch through the back of your legs, hips, and your back. You can add a little more prep by reaching the hands over to one foot and then switching over to the other. Center your hands in the fold and send your hips far back as you start to lower with control into the sit position. Take your time and allow your joints to move slowly. Use your elbows to gently push the knees apart. A couple of things to check in on. Are your toes facing forward? And are your heels down on the floor? If the answer is no, then it means you're cheating the position for comfort. Focus on lowering your hips only as low as you can to keep your heels down and your toes forward. Over time, this range of motion will increase. You just need consistency. If you're struggling with your feet hip-width apart, try separating your feet a little bit more. Just make sure that your knees remain over your feet and are not caving in. The more range you gain with this, the closer your feet can be. So try bringing your feet inside hip width and taking your time to lower into that squat sit position. If you're struggling to stabilize at the bottom of your squat, you can reach your arms forward or grab a heavy object that can give you a little help by pulling you forward slightly. With consistency, your range of motion and ability to stabilize will improve.